I wanted to talk a bit about what it's like to practice medicine as an anti-natalist. Not just me thinking about the theoretical philosophical questions, but the implications of day-to-day decisions and the emotions that accompany those decisions. One of my main motivations in becoming a doctor was in having a pragmatic skill set that can help reduce suffering by addressing health problems. Of course, there are innumerable ways to help reduce suffering, but medicine made sense for me personally. I only came across antinatalism later on in my career, but the motivation for this was also the reduction of suffering and harm. The longer I am in medicine, the more I realize that if I'm doing my job right, and if patients do their part in following healthy habits, I should be putting myself out of business. Although this could be taken in the financial sense, what I really mean is that ideally I should work toward helping people need me less. After all, this is what I want as a patient, to need as little medical care as possible due to being in good health. The medical system as a whole doesn't reward this type of thinking. It rewards revenue generation through greater healthcare use. More visits, more medications, more procedures. Obviously, I'm not against medical treatments at work to improve people's lives, and not every disease is clearly preventable, but a system that values treatment over prevention is pretty messed up, in my opinion. I try to keep all this in mind in my practice, but people are complex and their autonomy needs to be respected, so prevention is not easy to achieve, especially in a society that doesn't value it enough. To me, antinatalism is an extension of harm prevention. By not procreating, all the suffering the new person would have endured is avoided. To put it less diplomatically, if we don't make a mess, we don't have to worry about cleaning it up. Giving medical advice is a bit of a juggling act, with prevention, autonomy, evidence-based practices, emotions, cultural sensitivities, trust, and so on and so forth. Then there's a bit of moral distress that I feel when a patient makes a decision I find unethical. One time I saw a patient whose parent had recently been diagnosed with Huntington disease. Huntington's is an inherited condition that leads to movement abnormalities and psychiatric illness and eventual dementia, usually by age 40 or so. He had already had a child before he knew about this diagnosis, but now he was planning to have a second child. Despite this new information, he did not want to wait for genetic testing to make a decision. As a doctor, my job is mainly to inform and give advice. What people do with that advice is up to them. After all, it's their life and their body. But obviously I'm not a robot, and I'm not numb to the consequences of people's decisions. So with this patient in particular, there was a mix of emotions. I thought, isn't it reckless to go on with procreation, knowing that there is a very real chance of giving the child Huntington's? Maybe. But is it really any more reckless than having a child otherwise? Every time someone procreates, it's a huge gamble. So why was I more distressed with this situation? Maybe it was the fact that we were explicitly talking about it, and he still knowingly chose to procreate. This made me sad and frustrated. But of course, I didn't share my emotions with him because at the end of the day, it's not about me, but rather about him and the potential future child. I can only imagine what he has to deal with in knowing this information. I don't know anything about his family dynamics or his life goals or his fears. So although his decision is likely not ethically right, and it is tempting to be quick to condemn it, there's also a lot that I don't know. This is just one example. A more common related issue is when I give advice regarding contraception in general. As part of standard primary care, contraception is an important topic that should be addressed with everyone to whom it is applicable. If someone is sexually active and pregnancy is possible, I simply ask if contraception is used consistently and reliably. For those who want contraception and are not yet using it, I'm happy to talk about the options. For those who are not interested, I move on to the next topic. But at least I've done my job in reminding them of the obvious fact that intercourse without contraception could lead to pregnancy, and that contraception is an option. All in all, my anti-natalist beliefs probably have more of an impact in how I interpret and emotionally handle things than it does on my actual medical practice, other than to say that I place a great deal of importance on preventive healthcare and habits. I'd be curious to hear people's experiences with how you handle being an anti-natalist working in healthcare, or how you deal with healthcare providers as an anti-natalist, if it plays a part at all. Thanks for listening.